I'm not going to get into this story too much because it appears to be really speculative. I just wanted to let you know this was a little something I saw in case you haven't seen it. The Daily Mail story. Taking cholesterol-lowering drug could reduce the severity of something to the level of the common cold, study suggests. It's going to take a lot of data, right? Cholesterol-lowering drug Fenofibrate, Tricor, is providing a glimmer of hope. Scientists in New York and Jerusalem believe the drug could help reduce the vid. I tried to reach out to Nick Cannon to see what he felt about these results coming out of Jerusalem, but he was suspiciously quiet in terms of what he thought about these developments, because, the drug reduces symptoms so that the 19 is no worse than the common cold. Again, like with anything with this, take this with a grain of salt, right? Because we've heard a lot of things that could work, then we hear they don't work, then we hear they do work again, and it's just so difficult to get accurate information because everything's being politicized. Even possible cures, not saying this one specifically, but hydrochloroquine, those other kind of things that have been proposed, they're being politicized. So again, take it with a grain of salt, do your own research. Just wanted to point this out to you if you haven't seen this. So it says here, 2 scientists researching a potential treatment believe they may have success with a common remedy used to lower cholesterol. It's a professor here at Hebrew University of Jerusalem has been working for the past 3 months with Dr. Benjamin tenOever at New York's Icahn School of Medicine in Mount Sinai. In lab studies, the cholesterol drug Tricor showed extremely promising results, they reported. Wouldn't that be something if ultimately through all of this it was just like, here, take this statin. The pair's research appears in this week's Cell Press sneak peek. The Cell Press, everybody. I've had my subscription for 10 years straight, and I'm renewing for another 2 years based on this, the Cell Press. The two have focused on ways in which the 19 changes patients' lungs in order to reproduce itself. They discovered the virus prevents the routine burning of carbohydrates. As a result, large amounts of fat accumulate inside lung cells, a condition the virus needs in order to reproduce. The team believe their findings may help explain why patients with high blood sugar and cholesterol levels are often at a particularly high risk to develop the 19. We're only going to read a little bit more of this again. Like I said, I just wanted to put this out there if you haven't seen it. Investigate this stuff for yourself, and we'll see where it goes forward. So it says viruses are parasites that lack the ability to replicate on their own, so they take control of our cells to help accomplish that task. By understanding how the SARS-CoV-2 controls our metabolism, we can wrestle back control from the virus and deprive it from the various resources it needs to survive. That helps those individuals that are at most risk. I was listening to something last night. I can't recall what news channel it was on. They were talking about, okay, once a vaccine is found, who gets it first? So they were talking about healthcare professionals, obviously, those over 65. I would push back on that just a little bit, because what if those individuals at 64 are still getting it at rates of those individuals at 65, 66, 67? So I would say just let's lump elderly together for now until we can figure out which age groups, like where is the cutoff where individuals are really impacted by it. What if it's 50? What if it's 55, 60, where you see that 0.01, 0.02% mortality rate, but then once you bump it up to like 61, 62, 63, then you start to see like a tripling, quadrupling of those numbers. So we'll see what happens when the thing comes out. But additionally, healthcare professionals first, but I would say, what about first responders, law enforcement, essential workers, anybody out there who hasn't been able to not work, anybody out there who has had their job continue during this time. Those are the individuals I would think would be first in line for this. But whenever a company does break through with something, then you're going to see kind of the struggle back and forth in terms of how do we appropriately get it to individuals who are in the most need of things. But for now, I'm sure we'll see 50 other stories like this of something that may potentially be of help. It's good to see people out there trying to figure stuff out, bottom line. Scientists are out there kicking butt all across the world trying to figure this thing out and trying to come up with something, which is great to see. So perhaps they should be some of the individuals who get a little vaccination first as well when something comes out. Thanks for watching, everybody.